This story is based on an SCP anomaly. If you enjoy this story and want to listen to others like it, be sure to check out my other podcast, The SCP Experience. Link is in the description below. Now back to the story. I couldn't seem to get my leg to stop bouncing as I sat in the waiting room at my new doctor's office. It was my first visit to a doctor in years, unless you count a visit to an urgent care when I had a terrible ear infection and needed antibiotics. As a self-employed copywriter, I hadn't been able to afford insurance for years. But things were finally getting to a place where I was doing well financially and could spend the money on insurance. It was good because I'd just turned 40 and was starting to worry about health issues. I'd always been a bit of a hypochondriac, but ever since my 40th birthday, every little ache and pain had me thinking about all kinds of awful terminal diseases. The door to the back of the doctor's office opened, and my heart rate increased as a nurse stepped out and scanned the room.
Mrs. Westinghouse?
She called. An old woman got uneasily to her feet and walked stiffly toward the waiting nurse. I breathed easily, grateful for the extra few minutes before I had to go back for my establishing visit. Glancing at the front door, I had to force myself to stay in the seat. I wanted to leave, to just go home and try to forget about the possibility of getting terminally ill. But of course, just because you ignore something doesn't mean you will prevent it from happening. The door to the exam rooms opened again, and a different nurse stepped out.
Mr. Brand?
He said, holding a clipboard. I stood up and walked toward the waiting man with a fake smile on my face. After a little small talk, the nurse weighed me and took my blood pressure.
A little high, he said. Have you had high blood pressure in the past?
I shrugged.
I don't know. It's been so long since I've been to the doctor. Okay, we'll take it again in a few minutes. Sometimes the stress of visiting the doctor can raise it.
Yeah, I said.
That could be it. I'm definitely a little stressed right now.
The nurse smiled and showed me to the exam room, telling me that the doctor would be with me in a few minutes. I sat in a chair and waited, looking at the posters on the walls about how much you should exercise and what kind of foods to eat. There was a knock at the door, and then it opened and a man in a white lab coat came in. He had a thin fuzz of white hair on his head everywhere but the crown, where his deeply tanned skin was completely hairless.
Hello, Mr. Brand,
he said, fixing me with his deep-set brown eyes.
I'm Dr. Lister.
We shook hands, and he had me sit on the exam table.
So, I understand this is just an initial visit to establish care. But is there anything else that you want to discuss? Anything that you're concerned about?
I thought about the strange pain I had on my left side sometimes, and about the headaches I would get after writing for several hours straight, and about the way my skin sometimes looked sallow right after a shower. But I did not mention them.
No, I don't think so. Okay, good. Let's get a listen to your lungs.
Dr. Lister used his stethoscope on my back and directed me to take deep breaths as he listened. When that was done, he sat down on his little wheeled stool in front of me.
Well,
he said, then stopped abruptly, his eyes on my left hand. He frowned and rolled himself closer to me, grabbing my left arm above the wrist and yanking it toward him.
What?
I asked, suddenly full of fear.
What is it?
Lister pulled my wrist up and turned his head, putting it to his ear as if listening to it.
Move your hand for me.
I moved it, holding my breath and trying to hear whatever it was he was listening for.
Huh,
he said.
Very interesting.
Suddenly, I remembered every twinge in that wrist, every discomfort from writing for hours a day, every stiff finger or clicking noise when I moved my hand. I thought about all the times I'd popped my knuckles. Sure, I'd done some horrible damage to my left hand. Lister straightened, but still held my arm above the wrist.
Make a fist for me, tight as you can.
I did as he said until he told me to relax it again. He set my hand down gently on my knee and then wheeled over to the cabinets at the side of the room. He pulled on a pair of latex gloves, grabbed a disposable pad, and then snagged a pair of tweezers from a drawer. He wheeled back over to me and lifted my left hand, placing the disposable pad underneath. He gripped my arm above the wrist with his left and then brought the tweezers forward with the other.
What are you?
I sucked in an involuntary breath as he stabbed the tweezers into the back of my hand, digging them under the skin as blood sprouted from the twin wounds. I shouted in pain and yanked my hand away.
What are you doing? It's all medically necessary,
he said.
I assure you.
There was a quick knock at the exam room door before it opened. The male nurse poked his head in.
Everything all right in here?
He asked, just before his gaze landed on my bleeding hand.
Oh my,
he said, stepping inside and shutting the door.
I'm glad you're here, Aaron,
Dr. Lister said.
Would you mind bandaging Mr. Brand's hand up, please? I've done all I need to do today.
He turned his gaze to me.
But I'm afraid you'll have to come back as soon as possible. If we let this go on for much longer, I'm afraid you'll lose use of that hand. Lose use of the hand?
I asked as Aaron went about grabbing bandages and swabs.
What's wrong with it? It's a rare disorder called osteointitis,
Dr. Lister said.
You have all the telltale signs, I'm afraid. Wrinkly skin at the joints, bony protrusions at the knuckles, the ability to make a strong fist, unhampered movement of the wrist. It's all there. And if we don't act quickly, you may never be able to use the hand again.
As Dr. Lister spoke, an inexorable feeling of inevitability settled on me. All my worrying was suddenly justified. This wasn't exactly what I'd expected, but I knew there was something wrong with me. His words, although shocking and terrifying, also gave me a sense of calm. I was in good hands. Dr. Lister would take care of me. He would save my hand.
Dr. Lister is a leading expert on osteointitis surgery,
Aaron said as he cleaned the twin wounds on the back of my hand, further cementing the notion that I had to have the operation done sooner rather than later. When my visit was finished and I walked out of the office, I had an appointment for the next Monday at 5 o'clock. Lister would do the surgery then, and everything would be okay. I drove home feeling at once sick and elated. The next Monday, I arrived at the doctor's office at 4:45 p.m. The parking lot was mostly empty, and I figured Lister was staying after hours to do the surgery for me because he was just that much of a devoted doctor. I walked inside the empty waiting room and was greeted by Aaron, who took me back into an exam room and had me change into a gown. I waited in the little room, staring down at my left hand. I wondered how much of an expert you had to be to spot such an insidious malady as osteointitis with just a glance, as Dr. Lister had. You heard all the time about doctors getting sued because they were incompetent or downright sadistic, but it seemed that I'd lucked out with Lister. Not that I hadn't had my doubts. I had. After a couple of days had passed at home, I decided to look up osteointitis to see what all the fuss was about. I'd never heard of it after all. I couldn't find anything about it online, so I called Dr. Lister's office and asked him why I wasn't seeing any information online. He explained it to me as patiently as a teacher why I couldn't find the info online, and I hung up the phone once again, assured that my hand was in good hands. As I sat waiting in the exam room, I couldn't recall the exact reasoning for the lack of literature on the internet about the condition, but it didn't really matter. There was no turning back now. There was a knock at the door, and then Aaron opened it up and poked his head in.
Are you ready, Mr. Brand?
I nodded.
I'm ready.
I followed Aaron down the hall to a wide room with 2 chairs in the middle, about equidistant apart. Each chair had a metal table in front of it. Something seemed off to me about the room, and my brow furrowed. Aaron noticed.
Are you doing okay, Mr. Brand?
Is this the operating room? I asked. Before Aaron could answer, Dr. Lister appeared in the hallway, walking ahead of a woman in a gown identical to mine.
Yes, this is the operating room, Mr. Brand,
Lister said.
I assure you, everything's in order. Please, take a seat at the operating chair on the right and place your left hand on the metal table. We must get started immediately if we're to complete the operation before you lose use of your hand.
My problem with the room now seemed like a distant, time-fogged memory. I walked over, sat in the chair, and put my left hand on the metal table, positioned in front of the seat. Dr. Lister directed the woman to the other seat, and she put her left hand on the table in front of her seat. The doctor washed his hands thoroughly at the nearby sink, and then Aaron helped him gear up for the surgery. I sat still, my leg not moving at all, waiting for the surgery to get started. Aaron then stepped over and stood with his back to the doorway we'd come through, standing there with a faint smile touching his lips.
Okay,
Dr. Lister said from behind his surgical mask.
let's get started.
He moved over to a tray and lifted a surgical towel that had been covering the instruments. He picked up a gleaming machete and stepped over to the woman, who looked up at him expectantly.
Are you ready, Mrs. Olliard?
The woman nodded.
Excellent.
Dr. Lister said. He raised the machete, then brought it gently down to her wrist, as if aiming his blow. He did that once more. Then he brought the blade up and sliced it down with shocking force, severing her hand with a single blow. Mrs. Olliard screamed and clutched her wrist as blood sprayed from the wound.
It's perfectly normal to feel some pain.
Dr. Lister shouted over her screaming as he walked over to me. Oh, good. It's perfectly normal, I thought. My right leg started bouncing. I swallowed hard.
Once we get your hand off, we'll be able to put your new hand on, Mr. Brand.
Lister said as he positioned himself next to the metal table, with my left hand resting on it.
Not long now, and you'll be just fine.
Mrs. Olliard was still screaming, and something about it was digging through the haze that had settled over my mind at the sound of the doctor's voice. Lister brought the blood-stained machete down toward my wrist, testing to make sure his aim was true. Some of the blood dripped off onto the back of my hand. It was warm, and it reminded me of when Lister had jammed the tweezers into my hand. I looked at the 2 scabbed scars there, and Lister slammed the machete down. At the last second, I yanked my hand away, so he hit nothing but metal table. His eyes narrowed as fury flowed into them.
You think you know better than me?
He shouted into my face.
Put your hand back on the operating table.
Looking around, I realized we were in the break room at the rear of the office. There was a fridge and a table pushed to the side. A coffee machine sat on the counter next to the sink where Lister had washed his hands. Mrs. Olliard's screams faded away, and I glanced over to see her slide to the floor, blood all around her and staining her gown.
Nurse, please give me a hand here,
Lister said. I moved to stand up, but Aaron grabbed my shoulders and shoved me back down. He then grabbed my left arm and forced it toward the metal table. I resisted, but Aaron was strong.
Get it on the table and I'll finish the operation,
Lister shouted. Gripping my left wrist with both hands, Aaron got my hand onto the operating table as I tried to pull it back. I even used my right hand to try to fight back, but Aaron just ignored the weak punches I landed. I was still fighting, trying to pull my hand back, when Dr. Lister brought the machete up again. As he swung the blade down, I stopped fighting and shoved my hand forward. Aaron was unprepared for the sudden change, and he fell forward, right into the path of the machete. The blade thunked into the side of his head, sinking several inches into his skull.
Look what you did!
Dr. Lister shouted even as he yanked the blade out of Aaron's skull. I lurched away and headed for the only thing I could see to use as a weapon, the coffee maker. As I grabbed the coffee pot and spun around, I saw Dr. Lister swinging the machete at my left hand. I yanked my hand away, and the blade came down on top of the coffee pot, breaking the container. Bits of tempered glass fell to the floor, and I was left holding a handle attached to an irregular ring of jagged glass. The doctor raised the blade again, and I did the only thing I could to save myself. I punched him in the face with the remains of the coffee pot in my hand. The glass sunk into his face, tearing his cheeks up and puncturing his left eye. He screamed and dropped the machete, whirling around to get away from me, but he couldn't see. So he tripped over Aaron's body and smashed face first into the wall next to the doorway. He fell to the floor, unconscious from the blow to the head. I immediately ran down the hall to the exam room and grabbed my pants. I took them back to the break room, ripping my belt out from the belt loops. I used the belt to create a tourniquet on Mrs. Oliard's arm. Then I yanked my phone out of my pants pocket and called 911. I traveled to the hospital with Mrs. Oliard in the ambulance. The paramedics rushed us into the ER, and hospital staff came running up to us. One of the nurses asked me if I was seriously injured, and I said no. She told me I would have to wait outside. But then the attending doctor stopped the nurse, turning her attention from Mrs. Oliard to me. She looked into my eyes for a long moment, then turned back to the nurse.
Get this man sedated immediately. He has an asymptomatic and undetectable brain tumor. I'm sure of it. We'll have to operate immediately. Yes, doctor,
the nurse said, grabbing me by the arm.
Oh, Christ,
I thought.
Not again.
SCP-7303 is a behavioral phenomenon in which a medical professional, most commonly a doctor, will diagnose a patient with a non-existent health condition. Affected medical professionals are resolute in their diagnosis and cannot be persuaded that their assessment is incorrect or that treatment is unnecessary. Those affected by SCP-7303 demonstrate an increased persuasive ability and are able to convince both patients and other practitioners that their diagnosis is correct. SCP-7303 will persist until the affected medical practitioner decides the course of treatment has been completed. The anomaly has proven resistant to all Foundation efforts to control or impede the phenomenon. Current Foundation estimations stand at 82.1% of medical professionals worldwide experiencing SCP-7303 over the course of their careers. Due to the impact active intervention would have on medical services and the level of Foundation resources required for proactive containment, the Ethics Committee has decided not to pursue further containment attempts. Thanks for listening. If you enjoy these stories, be sure to subscribe to the podcast and check out some more of my episodes here.